Aside the teething challenge of inadequate ambulance, the service is also battling with inadequate personnel. Currently, the Ghana National Ambulance Service has only 50 operational ambulances and about 2,000 personnel nationwide. However, after an appeal, the Ministry of Finance has given the financial clearance to recruit some more personnel.
In the work that we do, each ambulance station should have a minimum of 10 personnel. That's the minimum. We should have more than that. But if we don't have enough at all, it should be a minimum of 10 personnel. And that type of personnel, if you multiply by the number of ambulances, then we are talking about 3,000 plus staff. But as we speak now, we don't have that number of staff. So hopefully, government has given us clearance to train more personnel. And so we've been given clearance to train additional 900 personnel this year, which we have just started the recruitment exercise. The first part is for drivers, which we have advertised, and people have just applied. And we are now going to do the screening to select those who qualify, and then we send them to our training school for training.
The government of Ghana, under the One Constituency, One Ambulance project, is seeking to address the issue of lack of ambulances. Currently, it has imported 211 ambulances and is expecting an additional of 48 to be commissioned and distributed on the 28th of January this year. Head of operations at the National Ambulance Service said the move will help the ambulance service effectively deliver quality healthcare to citizens.
The job that we are doing, it is the ambulance that is our main tool. So without the ambulance, nobody sees the work that we are doing. So now that we are going to receive this number of ambulances to add up to our fleet, it means anytime somebody calls us, we will have the availability of an ambulance to respond to the call.
They are, however, calling on the government to establish a sustainable source of funding for the ambulances, as the service does not charge patients for their services.
As far as emergency is concerned, nobody demands any charges, because you don't, at the time that the person has collapsed or is involved in an accident, you cannot go and stand there that pay something before we send you to hospital. No, it cannot be done. We treat free. It is only when a patient is stabilized in a hospital and you are supposed to be sent to a higher tertiary hospital for an advanced care, then we say that pay something to support the fueling of the ambulance. That's the only time. But I believe that with this number of ambulances coming in, government will make the necessary policies to see how best we can sustain the service of the services of the ambulance, because there is such that if everything is free, then it means maintenance of the ambulances and other things is going to be difficult. So there should be a way of getting a dedicated source of funding, so that at any point in time, any of the ambulance due for service, we will be able to get the necessary money to buy the spare parts so that we can service them all the time.